I would describe our patients as somewhat breathless. It's hard for them to talk to us in a normal way, especially when we're explaining how we're conducting the study and what we like to do as far as getting them into the care of the trial. As a generalization, that the patients are pretty wiped out, and they're actually looking forward to getting medications to help them feel better. Without being, again, on the front lines, without seeing these patients and seeing these patients struggle, that the public really understands how sick these patients really are and how much they really are reaching out for our help to make them feel better. When we talk about this new remdesivir study, this new drug study, one of the first things that they ask me is, is this going to make me feel better? And there's no guarantee for that. And that's why we do studies. There's no approved drugs for COVID-19. There's a lot of drugs that are being developed. This is probably one of the drugs that's furthest along, being studied in thousands of patients worldwide. And the patients are, they feel that if there's some hope there, that we hope to carry them through. The difficult part is, when we learn that, a patient has died, really. That's very difficult. And, these are patients that we've talked to and seen and examined, just, maybe the day before, and then we come into work and then we learn that they die. It's, that's rough. As a doctor now for over 20 years, we see this and we have some sort of shields that we put up that protect us against some of the emotions that can pour out. But here, it just seems that, the numbers of people that can die from COVID-19 are higher than, we see in our usual, everyday work. And so those are some of the rough spots. We had a patient today who had been on the drug for the full 10 days. And today was day 11, and today was her day to go home. And the hospital staff cheered, when they gave her a standing ovation when she basically left the floor. So those are the bright spots. Seeing progress, seeing patients actually improve, they're able to breathe better, and just supporting my colleagues. Again, day by day, we hope for progress, and so far, more patients are responding than actually, move into the ICU. So it's encouraging, and so those encouraging signs get me back to work every day. Positive words, it's all about hanging in there and supporting each other. So I think, again, it's a team effort, and we rely on each other.